You're watching the JJ Podcast.
Kellie Sloane is a member of the New South Wales Legislative Assembly for the electorate of Vaucluse. She represents the Liberal Party and since July 2024 has served as Shadow Minister for Health. Before entering politics, Kellie built a diverse career as a journalist, working across both TV and radio with commercial networks such as ABC and Nine, and later transitioned into leadership roles in the non-for-profit sector. Today, we chat with Kellie about the state of our healthcare system, privatisation of hospitals, Australians wanting choice in healthcare, Labor's broken promises, and improvements needed within Liberal messaging and the Liberal brand.
Well, Kellie Sloane, thank you so much for joining us today. We really appreciate you taking the time.
So nice to be with you both.
And here in Parliament House too, I always feel like it's such a special treat when we get to come on an excursion. To Parliament House.
I know.
Now, you're a first-term MP. Just tell us a bit about what that experience has been like at the start. So you were voted in 2023, we're now in 2025. How's it been?
So it's been the best of times and the most interesting of times too. It wasn't that long ago that I was elected, but it feels like an eternity because so much has happened in such a short time. I remember walking in here on the very first day. It was a bit like first day of school. I remember the first question time, and nothing prepares you for sitting in that chamber for the very first time, in the bear pit, they call it in New South Wales. And then hearing the noise and the combat in there and walking away thinking, wow, how am I going to do this? And then you step up and you get into a rhythm and, in a very short time, making a contribution for your community and for your state. And it's such a privilege. I love it. I love my community. Nothing also prepares you for how responsible you feel for your community, how close you come to your community very quickly in ways that you hadn't expected. So it's an enormous privilege.
You just mentioned about how you had to step up and step up quickly. And I must say, in the time that you've been in Parliament, you've got such a great reputation right from the start. And the reason why I say that is because already there were headlines that potentially you could be the next leader of New South Wales. And you've always been a very good supporter of mine, and I loved reading that sort of stuff. But I know that you then came out and said, well, I'm not going to be doing a leadership spill. This is not happening. But for you, what is that like? And how do you go through those sort of rumours while you're then walking the corridors of Parliament House?
I think it's just head down, bum up, get on with the job, right? Because
Avoid the distraction.
the one thing I know, especially from my careers prior to politics and working in media and being in advocacy, is there is nothing people dislike more than politicians talking about themselves. Politics, I think, is a team sport. And I've always backed in the leader, and he knows that. And Mark elevated me very quickly. As soon as I entered Parliament, I moved into Shadow Cabinet as the Shadow Environment Minister, and then moved into the health portfolio. So I've had pretty high-profile roles within the parliamentary team that have given me more exposure than others might have had. And and if people are saying I'm doing a good job, well then I'm very grateful because I take my job very seriously, and that is holding this government to account when it comes to healthcare and other matters.
While you touched on the leadership speculation and politics can be a dirty game, there's always rumours and there's always media attention, and it's not necessarily what you want it to be. I just wanted to ask, so right now, since you've been in this position, federal Liberal, state Liberal, local Liberal, the brand has been facing a bit of an identity crisis. It's been a very challenging time. I imagine it's been a very challenging time for you. In terms of grassroots support, it's been on the decline, I would say, what we've been experiencing in our own local seat. How do you think we fix branding?
Well, I think what we're seeing federally at the moment is a really natural byproduct of an election result that was pretty shocking for us all. So there's a lot of soul searching. But at state level, we the last state election, we were removed from government after 12 successful years. People did not come at us with baseball bats. They weren't angry. They didn't think we failed them. In fact, we left on really good terms. A good separation with the New South Wales public that I hope will be a short-term separation. And so we are an extraordinary team, I have to say. There are people sitting in our party room that have cabinet, executive government experience. We have young people, 6 people under the age of 40 and a few more that have just aged out into their early 40s. You know, the youngest female in Parliament, a young Muslim woman in Parliament in the LA. People like me that have come from outside of politics, bringing real world experience. So we've got a team that can absolutely smash it. We know what we stand for. And I just believe we need to better articulate our brand position now. And what we can bring to the electorate so that we can return to government in March 27.
Communication is definitely one thing
Yeah,
that's come up quite a lot about
my
how the
passion
Liberals aren't the strongest when it comes to messaging and communication, which really takes it through to, I had never really noticed, and this could just be because when you're working in sport, you're not following politics on TV as closely as when you're actually in it and running in an election. And I just noticed, and you've come from Channel 9, and I noticed during the campaign just how hard it is to get Liberal coverage in a positive light, and whether through algorithms we fall into already people that might follow Liberals, you don't necessarily fall into the left-leaning algorithms. But how do we counteract the way that the mass media often produces Liberal skewed stories that aren't always in our favour?
Well, I think that's on us. That is our problem to solve.
Yep.
And the moment you start saying, no, you're not listening to us or you haven't heard us, then you've lost the battle. And if we want people to hear us, we need to start thinking about how we speak to them, where we're speaking to them, and particularly in the case of young people. So at the last election, just over 50% of the voters at the ballot box were under the age of 40. So we're not going to be talking to them through traditional media anymore, not through newspapers and TV and even some of the online channels. We need to start engaging with them on podcasts, on YouTube, advertising in different ways, seeking third-party endorsement. And I think the Liberals have not done as good a job as we should have in those spaces. And we need to meet young people and other diverse communities in the spaces where they meet. So I think if the community is not hearing us, that is our problem. That is on us. We have to do better. And I think there are a lot of people in our parliamentary team in New South Wales who are starting to do a really good job of that. And we will wind that up in as we get closer to the next election campaign. But it's getting harder to reach people. We need to think outside of the square. We need to get uncomfortable, and we need to start thinking about who we want to reach and where.
Yeah, I had said to Jaimee, we were at a women's forum a couple of weeks ago, and people were talking about improvements within the Liberal Party with women's issues, health issues, and I said exactly this. I was like, I'm not even going to make a suggestion about a health issue or a women's issue that I think can be improved, because it's all about messaging. You can have the best policies in the world, but if you can't articulate to the mass public why they are going to benefit from that policy, then what's the point? So it was very refreshing to hear you say that. No, honestly, it's refreshing.
We just got to take accountability. We can't blame anyone else for our failures.
I do want to blame the media though. They frustrate me a lot.
Yeah, but you know what? I used to work in the media, and so I get it. And these days, the media has changed a lot. It has shifted, to your point, right? That some have their inbuilt bias. But I think the media is a little bit like a buffet, and you go up and that bit might be to your liking and that bit might not be. And this is the problem. Once we choose that bit from the buffet, unfortunately the algorithms keep feeding us the same
the
kind
algorithms
of meals.
have a lot to answer for.
And
it's
they do.
A really interesting time in politics with algorithms, because the middle ground is
eroding.
It's
eroding.
a great way to look at it though, the buffet, and you just keep getting served the same part of the buffet.
But we're going to use this now.
Yes.
It'll be the Kellie Sloane buffet.
Let's talk health. Because you are the Shadow Minister for Health. But I just want to start, I know mental health doesn't fall under your portfolio, but this is definitely one area that, as you know, I'm very passionate about. And ABC Four Corners did this awful, they sort of really blew open the lid on how dire mental health is in our state. And just one of the examples was more just how long patients were waiting for a bed. There was one gentleman that was 93 hours, and I just watched that and I thought, this is New South Wales in 2025. How have we gotten to the situation that we're in, where psychiatrists are wanting to walk off the job? We don't have mental health beds. Mental health hospitals are being quietly closed. How did we end up here?
I think this is one of the great failures of the Minns Labor government, that they allowed psychiatrists in our public hospitals to resign en masse.
200.
And they haven't resolved the issue. And that leaves the most vulnerable people in our community at risk. And let's face it, it also leaves our community at risk too. So I represent the eastern suburbs, and we had a terrible tragedy in our community at Bondi Junction. And the coronial inquest looked into the impacts that mental health and the failures of our mental health system have contributed to situations like that, not just in Sydney but around the country. And in the midst of something like that happening, in the midst of a rising epidemic in anxiety and depression and other mental health issues, that we are letting that happen in our hospitals, and the minister was on holidays when it happened, and it still hasn't been resolved. And there was this narrative that I really object to, that we can't be having a conversation about highly paid psychiatrists who, by the way, give up at least 10 years, up to 12 years of income earning years before they actually get into the workforce. But we can't have that conversation about their wages because they're rich and entitled. I can't tell you the amount of times I heard that from Labor government ministers. Not the entitled part, but all the other, rich doctors earning more. But the cost to our system of not paying them is enormous, and the cost to individuals is dire. And actually, if you just look at the plain economics of it, it would have saved our budget more to pay them than it does for bringing in casuals. So I think it's a disgrace, and the impacts aren't fully felt yet.
Northern Beaches Hospital.
I was just going to mention this.
Yes.
I'll be there in a
You're
couple
going
of
there in a
days.
couple of days.
I have a
Now back
surgery
in
on
government
Wednesday.
hands. What did you make of this decision, and is this something that you see moving forward, just to ensure that hospitals aren't privatised again?
So the opposition supported a transition of those private acute services, including the emergency department and maternity and other bits and pieces, back to public hands. That was something that we have supported in a very bipartisan fashion in New South Wales Parliament. I've stood up at Northern Beaches forums and spoken to the community, quite close with Eloise and Danny Massa through this ordeal, who, the family who have just been so extraordinary in their advocacy. So tick, 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 we are there to support the community. One of the concerns I have, though, is that the consequences of bringing the entire hospital into public hands and removing private services, the potential to be removing private services from the community. So the Northern Beaches community has one of the highest rates of private health insurance in the country. I know that, in places like Manly, 86% of people have private health insurance. They value choice. So in giving the community what they deserve, which is a really strong public emergency department and other services, mental health and maternity and other services, which we support, we cannot lose the private hospital side. Because when that happens, you see senior experienced clinicians leaving that hospital and going elsewhere, and I know that is already happening. And so there are services at risk, cancer surgery, other specialist services that are at risk in the Northern Beaches community. So we have been saying that the government, which is still working through the mechanics of all of this, needs to ensure that remains as well.
At the recent federal election, it's our favourite. We did it with Jane Hume. We're like, Medicare card. The Albanese government, told the public that all you were going to need is your Medicare card. And I know it's only been, how many months has it been since? Well, they've been in power 3 years, so it's not happening as quickly as it should. But at last report that I saw, it said that only 12% of GPs or of centres were confirming that they were bulk billing their patients. How are you seeing that infiltrate from a federal promise into New South Wales?
And do you actually think they're going to be able to live up to their promise that all you'll need is your Medicare card?
Well, voters have been completely ripped off. You know, they were sold a pup. Albanese went out there everywhere, with that green card, waving it in front. And I know for a fact, because I've been into communities where GPs have told me the very next day people turned up to the clinics and said, here's my Medicare card. I don't need my credit card anymore. And that never eventuated. And so the anger is actually palpable. People feel cheated out of their vote. So many people voted for that because this is something so important to people. In a cost of living crisis, where your energy bills are going up, where you can't afford your rent, and you are putting your health last because you can't afford it, to pay that gap when you go to the GP, to have been promised something that you thought was going to eventuate, because quite frankly, that was the message we all got, and it didn't eventuate. People are right to be angry.
Yeah. And you've hit the nail on the head, because this same report that said that the 12% of GPs had confirmed that stated that in a survey, there's the highest amount of people on record are admitting that they delay or prolong seeing a doctor because of the cost. So.
And I'm hearing even stories in pharmacies of people choosing which drug they're going to get because they can't afford it. And so this is the problem when people aren't seeing their GPs. They're waiting longer, they're ending up in our emergency departments.
Yeah, and then there's
and when they're ending up, there's a backlog in our hospitals. And to make it worse, another federal failure is their inability to keep their promise on aged care packages as well. So we have 1,100 people in hospital beds in New South Wales at the moment that should not be there, who should be in aged care facilities, but there aren't enough beds. So there is this tug of war between the feds and state. And while ever that happens, there are people suffering, languishing in hospital beds that don't need to be there, and more people clogging up our system at the other end because we don't have enough primary care. So the federal government really needs to step up and hold up their end of the bargain, and the states need to be applying pressure to make sure that that happens.
One thing, just speaking about the backlog of what's happening in the health system, is the wait times for surgery. And this came up in a recent forum that I was in, and I just went and then sort of looked into a little bit more. But there were numbers like 8,500 patients are waiting longer than clinically recommended for their elective surgeries, which just seems, so this data was from the first 3 months of 2025, so I can only just imagine this would be significantly worse. But it was this stat, this is up 151% from the same period in 2024.
Yeah.
Surely this raises concerns about what...
I
just
got
saw
no
that and I
words.
had to fact check it because I was in this forum and I thought, I'm just going to
you're right.
explore
And
this.
actually the full wait list, the extent of the full wait list was over 100,000. So that's back to sort of COVID era levels where we had actually shut down the theatres. Now, the current government has given some top-up funding to address that backlog in the short term, to put patients into the private sector so that we can get through the list faster. But the problem with this approach is it's kind of a boom or bust. It's emergency funding that will solve the problem in the short term, but we're going to be back in the same spot. And I'm really proud that when the state Liberals were in power, the coalition government, the wait list never got really over 1,000 up until we hit COVID. So there is a systemic problem that is not being addressed, and we're not going to solve it through short-term emergency funding.
Am I also correct? This is something that I researched this morning. When you just mentioned that it had never risen above 1,000, I had seen that. And with the backlog post-COVID, it's my understanding that the coalition government at that time had invested $408 million. So that was the 2022-2023 budget to slash that backlog.
That's right.
And then Labor failed to reinvest it.
So the thing is, that Labor saw, it was this huge peak.
Yeah.
We invested that 400 million, which by the way, we'd invested another 400 before that. But then, and that helped, so the trend line went down.
Yeah.
Right, in Labor's first year in government, and they claim credit for that, even though we'd put the funding in, but whatever, the wait times are coming down. So it did get down, but it has been going back up. So
so they failed to reinvest it. Yeah, and then
we've had like
spikes.
a $23 million top up at $200 million. But again,
Still nowhere near the 400 though.
But it's
and no
Band-Aids,
longer term issues. So we need to start thinking about more consistent funding to keep those backlogs in check. and looking what we can do. And, you know, a lot of it is, you know, people with hip replacements, knee replacements. You know, a lady contacted me the other day. She was in extreme pain. She needed shoulder and knee surgery, and was told that the first appointment she could get for that was in March 2027. So she literally has to wait until the next election to get seen. And that just, this is not...
It's not good enough.
The system says that's okay, it's not urgent. But this is a woman who, you know, can't actually get to the sink to do the dishes at the moment. Can't, you know, so that's a very good excuse for Harvey to go and do it.
all that, yeah.
But
because
no,
it's not a heart,
these
it's
are
not
real
deemed
lives,
life-threatening.
people living in pain, whose quality of life suffers, and the less they move, the more of a problem, the more chronic disease they have, the more prone to falls they are, and the more impact on our system. So there's actually an economic imperative for us to get through this list quicker as well.
What are some of the things, I'm no means asking you to make any policy announcement right now, but the next election's in 2027. What are the plans looking like for the Liberals in terms of, obviously you're going to be holding this current Labor government to account, which is so important to have that strong opposition to ensure you can highlight any of the Labor failures. But what does the next period look like leading into 2027 for the Liberals?
Well, we're all working very hard on policy at the moment. We've been meeting with stakeholders, developing our policy offering for the next election. The landscape's changed in a few years, so we need to have relevant contemporary policies that appeal to the people that have their ears open and are, you know, willing to give us another go. We need to have a vision for New South Wales. And this is the thing that we're really proud of, whether it was Mike Baird or Gladys Berejiklian or Dom Perrottet, they were governments that were builders. They built the metros, right? They built 180 new hospitals and health facilities with another 130 in the pipeline. You know,
it must kill you when the coalition government set up stuff like even Northern Beaches Hospital,
Labor's
but then Labor gets to cut the red tape, cut the ribbon. It's like...
Look, it's happening over and over again.
Yes.
And, you know, we just want New South Wales to progress. And I feel like under Labor, New South Wales has lost its spark. And we're not building for the future. The government is in office, but they are not governing. And so, you know, we should be the premier state, right? We should be the engine room of the country. And the latest growth figures show that we are lagging behind. Job completions, you know, for new houses, some of the lowest in the country. There is no investment in future infrastructure in health. $1 billion ripped out of the forward estimates for health infrastructure. So we might have a government that says all the right things, that sounds very reasonable, that isn't offending anyone, but they're not doing anything either. And so it is incumbent upon us as an opposition to live up to our proud Liberal history and show that we are a team of vision and of promise, and we will help lift people up who deserve a chance. We will not bloat the public service and ignore small business. We will be there for individuals. We'll have smaller government, and we will, you know, try to bring our society back together, you know, a society that feels increasingly fractured.
Yeah, absolutely.
Well, let's look at your electorate, because there's a few things going on in your electorate which, not to the same extent as what's happening in Woollahra, but in Warringah, you're often called, and same with us, always called the NIMBYs in terms of not wanting to have development within your electorate. And I always correct people and say, we're happy to have development, but in a way that's not going to destroy a suburb in the process. So right now in Crow's Nest, these massive towers are going up and there's no schooling for these new families that are going to come in. Right now, kids are having to go to Mossman because the Camaragal High is full. The hospital can't accommodate more people. So I always just say, like, you want to have development, but you don't want to then ruin suburbs in the process. And I think that that's something that's potentially going to happen with Woollahra. Now they're going to be doing the train station, but it's the 10,000 homes that have been proposed for that area. I don't know your area as well as I do mine, but I have driven through that place where it's proposed to be, and it's already quite congested. Where is this proposal at? And yes, I know that a train station might help alleviate some of the traffic congestion that's going to come through with all of these new developments, but I feel as though
Train
it's
station
going
with
to be
driverless
gridlock.
trains, where we put
But
drivers in the driverless trains.
Yeah, but I feel like it's just going to create
Look.
absolute gridlock, chaos. Where are these kids going to go to school? It just seems like a much more of a flow-on effect than just plonking 10,000 dwellings.
Look, I've always been pretty pro-housing. I've said we can be far more ambitious for Edgecliff Station, train station, which is on a big road, just down the road about 600 metres from where this train station is. I said, go for your life above Edgecliff. That makes sense to me. Or at the other end of the train line at Bondi Junction, which is also a major transport and commercial hub. That makes sense. But to put Woollahra in the middle, I've been on the record as saying, no problem with the train station if you want to invest $200 million in this community that's already reasonably well served by transport. Yes, to development. We need to do our share of the heavy lifting, just like all the other suburbs. But it's already a pretty high density suburb. 80% of people in that suburb live in flats and apartments already. It has small, narrow roads. It's a lot. It is 95 21-storey towers. And that's never going to happen. It is not realistic, and it shows the extent to which this was a political decision, not a strategic one. And I did what's called an SO52, which is a call for papers. It's like a Freedom of Information request, and that revealed that transport officials, roads officials, had only 72 hours to provide the information to Chris Minns before that press conference. We know that Sydney Water wasn't given a heads up before the announcement, so they are scrambling to get the data to see if their infrastructure can support it. They think maybe it can, but they didn't have notice either. The local schools, where they said there was plenty of capacity, they included the private schools in those numbers. Local Woollahra Public School last year was full until Labor cut one of its opportunity classes, and now there's a little bit of gap. So this is a highly, I rail against political decisions. I don't mind strategic decisions. So I'm not going to oppose a train station. If they're going to invest $200 million in my electorate for a train station to benefit multi-million-dollar apartments, I think that is a bizarre move for a Labor government, particularly when southwestern Sydney and places like Leppington have been crying out for rail infrastructure and have been leapfrogged by this decision. So this will be a legacy for them if it doesn't work out. This will be a black mark on their name and potentially a very expensive gift to the eastern suburbs that won't, in the long term, deliver the housing infrastructure that they are hoping or expecting it will.
Kellie, I love the way you articulate this stuff because it's just said so straight to the point, matter of fact. It has frustrated me for a long time, but I feel, I don't know if it's a media thing or if we're in the space more that I see it, but whether it be the federal Labor government or the state Labor government, there are just so many promises they make and things they say for political gain. I mean, the recent one, he'll cut your Medicare, we saw it at pre-poll with Labor and Teal volunteers literally yelling, don't vote Liberal, they're going to cut your Medicare. And then, you get to a New South Wales state budget only a few months ago and Labor slashed funding rebates for IVF. And, if a mean coalition government did this stuff, there'd be an outcry. So
we're seeing a lot of empty promises. We're seeing a lot of scare campaigns. Labor is preparing to mount a huge scare campaign over privatisation with the Liberals yet again. It's the same old tricks, the same old dirty tricks. They're pulling out information from over a decade ago, citing abandoned plans to privatise some regional hospitals, which never eventuated, and then putting my face on it now, 13 years later. It is desperate, it is dirty, and quite frankly, the people of New South Wales deserve so much better than that. And they will see through it. They will see through it because there's only so long you can govern in name only, but not in actually doing anything, in delivering anything, in having promises for future investments, whether it be rail or roads or health infrastructure. At some point in time, the people in New South Wales will look at this government and say, we're onto you. We can see through that and we deserve better.
Well, Kellie, thank you so much for your time today. It is so great having you in Parliament. I can't wait to see what more you do.
It's so great to be with you guys. Thank you so much for giving us a voice.
No, thank you.
Thank you for listening to the JJ podcast.